A 65-year-old patient presents with hemoptysis at the emergency room. He's a smoker of more than 30 years with 2 packets per day. The patient has lost 50 kilos in the last 3 months. On the physical exam, the patient coughs frequently and takes deep breaths. The right arm has a BP of 140/80 and the left arm has a BP of 110/60. The chest X-ray shows an irregular nodule with speckled calcification towards the mediastinum. What is the poor prognosis factor seen in this patient? A. Speckled calcification on chest X-ray. B. Hemoptysis. C. The difference in blood pressure between the arms. Or D. Rapid weight loss. Start with A. Speckled calcification on chest X-ray is differentiating diagnosis between benign or malignant nodule, pulmonary nodule. If we have a speckled calcification for a chest nodule, we will think that there is a malignant nodule. Hemoptysis is not a specific finding. Hemoptysis can be seen in TB, can be seen with pulmonary hypertension, therefore it's not even a factor of differentiating between cancer and other conditions. The last two discuss about rapid weight loss and the difference in blood pressure. Rapid weight loss is seen in advanced stages due to release of IL-6, a cytokine that leads to metabolic overdrive and losing weight. The difference in blood pressure has to pinpoint our ears a little bit because the patient has no history of a congenital disease. The difference in BP here cannot be explained by a coarctation of the aorta, as it was a part of his history that would have been mentioned. However, on the chest X-ray, it is said that the patient has a nodule that invades the mediastinum. This means that there are rare cases when the tumor invades the aortic arch. In the moment we have invasion of a structure such as the aorta, but also it could be the recurrent laryngeal nerve, for example, and the patient could present with hoarseness, then it means that it's not surgically resectable. This is a sign of poor prognosis. So the correct answer is C. The difference in blood pressure with the chest X-ray showing a nodule invading the mediastinum is indicative of tumoral involvement of the aorta. Let's review some of these poor prognosis signs in the case of lung cancers. The poor prognosis signs of lung cancer are hoarseness, this means involvement of the recurrent laryngeal nerve, fractures, metastasis to bones, or aortic murmur or differential blood pressure that leads to an indication for invasion of the aorta.